Hey, this is Dan Rozek, and this is a quick Q&A with Dr. Jeffrey Baker. We will be talking about soccer and medicine. Dr. Jeffrey Baker is a partner physician at Weil Foot and Ankle Institute. He is a former athletic trainer, and he is a current soccer player. He played college soccer at Northeastern University in Boston and continues to play soccer for Green and White in Chicago. He is a foot and ankle expert. So, Dr. Baker, what do you enjoy about being a podiatrist and a soccer player?
Dan, thank you very much for the introduction and the opportunity to speak to you today. Why do I enjoy being a podiatrist and soccer player? I enjoy being a podiatrist and soccer player because they're two of the passions of my life, medicine and sports. I've always enjoyed sports. Sports is something that teaches you to use critical skills, to play and work with others, to enjoy life. And I think sports is just a great building block to be able to be a good human being, a good person, and assimilate into society and learn how to achieve goals and reach those goals. And medicine is no different in terms of any profession that we go into. It's got to be something you love and enjoy. And my entire life, I've loved and enjoyed medicine. That stems from my father being a firefighter paramedic, and my mother being a social worker. So helping people has always been something that I've always wanted to do. With that, I decided to go into sports medicine because of my love for sports and my love for medicine. And that brought me down a road to becoming a podiatrist, and then ultimately having a job where I had the ability to see a lot of soccer players and combine the two of those loves. So for me, the ability to choose a sport like soccer that you can keep playing into your 40s, 50s, 60s, and then having a job where you can see patients for many years allows me to put those two together and really love what I do as a hobby in terms of soccer and what I do as a profession as a podiatrist. And then on the professional side, to be able to see soccer players and be able to talk the talk and walk the walk in terms of treating them.
Personally, I want to play soccer as long as I can, but I know that there is a limit to how much you can push your body. So, Dr. Baker, what is the secret to having a long soccer career?
The secret to having a long soccer career is really, as we see in older athletes, is keeping up flexibility and endurance. Flexibility, your muscles getting tight, or inflexibility is something that really can cause injuries. We look at injuries as you get older as being overuse injuries. Most often that's overuse on bone, overuse on tendon, overuse on ligaments. And as we get older, the flexibility you have decreases, making you inflexible. And when we're inflexible, we do not disperse forces as evenly across the feet and lower extremities. And then we end up having more injuries. So that's why it always is about stretching, 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 and staying flexible. And when you stay flexible, it decreases your chances of having injuries. And having a long soccer career is the fact of keeping yourself in shape, keeping yourself flexible. And then obviously there's an aspect of luck in terms of just injuries. There's some injuries that you just cannot avoid. And I've had some injuries over the years, but thankfully none of those injuries have been career threatening, which would keep me from being able to continue to play recreational soccer into my older years.
Looking back at my own soccer career, I remember having a lot of injuries. I remember in high school I had a really bad ankle injury, and my parents had a hard time deciding if they should take me to the ER or wait to take me to a physician. It was a Friday evening, so they would have to wait until Monday to take me to the doctor's appointment. So my question is, do you have some deciding criteria to give to parents out there?
For parents, the criteria, you have to use your better judgment in terms of what injuries have occurred and how quickly they need to be seen. The big question, as you stated, is what happens with a lot of sports that happen over the weekend where it's difficult to get into a facility to be seen by a specialist. A couple things with that. First and foremost, most large orthopedic practices and practices like our own, Wild Foot and Ankle Institute, we have the ability to see patients extended hours, so later on at night and on weekends. So within our facility, we have Foot and Ankle Sports Medicine and Trauma Immediate Care Center, or FAST. And that immediate care center is open 8 to 6 Monday through Friday and 8 to 12 on Saturday, so that you're able to see a specialist right off the bat. And orthopedic practices, the same thing. They have a lot of open hours, ortho immediate care centers that are open early in the morning, on the weekends, especially during high school sports season, so patients can get seen by a specialist immediately. However, when you have more severe injury, it is important to be seen when it is a Friday or Saturday, or there's any question about the injury. Going to an immediate care center, generalized immediate care center, or an emergency room is important to make sure that there just isn't more of an injury. At a minimum, those centers are going to treat the condition conservatively and at least make sure that if there's a fracture, that you're not walking on the fracture in terms of lower extremity injuries like I see in terms of foot and ankle injuries, and at least immobilize the patient and make sure they're not going to make the situation worse over the several days until they're able to see a specialist about the condition. So it's using your better judgment in terms of, for our aspect of foot and ankle that I see patients for, and soccer injuries. Most often those could be rolling an ankle or injuring the ankle where there's a question, is it an ankle sprain versus an ankle fracture? And most often if the child can walk, or the adolescent can walk on the foot, they most likely don't have a more severe injury, and you can do rest, ice compression, elevation until you can get to one of the specialist immediate care centers for further evaluation, or to an office to see a doctor on Monday. However, if the ankle or foot is significantly swollen and there's an inability to walk on it, there's a distinct possibility they could have a fracture or a very severe sprain, and in those cases being seen immediately in an open immediate care center or urgent care center or an emergency room is important to make sure that that injury that occurs does not get any worse until the time that the athlete is able to see a specialist come Monday morning when things open up regularly.
In physical therapy, injury prevention comes up a lot, and there are even debates on if it's even possible to prevent injuries. What are your thoughts on injury prevention?
My thoughts on injury prevention are the things that you do in terms of physical therapy and preparing people to prevent injuries. And again, that comes down to the same thing I said about being able to have a long soccer career. It's really about flexibility more than anything else. Flexibility, muscle strength, muscle endurance. There's some injuries you just can't prevent. You in soccer get tackled by another player and it's a hard tackle, and you're just you injure the ankle or the foot, and it happens, and there's nothing you can do to prevent that. But your overuse type injuries that occur during soccer, stress fractures, tendonitis, things of that nature, can be prevented in a couple of ways. One is the flexibility issue. That is a big question in terms of, we see athletes that come in with injuries of unknown origin from sport, that they don't remember a specific inciting event or traumatic injury that occurred, but they have pain afterwards, that a lot of times we see that it's inflexibility. And then certainly prevention of injuries can go along with, on the soccer aspect, shoe gear. So making sure you're in the right cleats, and you can use some inserts to go into those shoes to disperse forces across your feet to try to prevent especially the overuse type injuries. So shoe gear and flexibility are the big keys, I think, to preventing these overuse injuries.
Injuries can be challenging. Even though I've had some bad injuries in my past, I continue to play to this day, and I would not trade any of those for my soccer memories and friendships I've developed. What are some of your favorite memories as a soccer player?
My favorite memories as a soccer player is I played college soccer at Northeastern University in Boston. And it's actually not the on field stuff, it's really the off field stuff. It's being a part of a collegiate soccer team was amazing. And the fact of the camaraderie that I made with all the other players, going on road trips with them, practicing and training every day with them. That's what made it amazing. I couldn't imagine my college career of being in college as a sports medicine athletic training major, what it would have been like if I didn't play sport at the same time. And as a walk-on at Northeastern University for the soccer team, it was a privilege to be able to be on that team. So my memories really come from just being on that team and being with the other players and being a part of collegiate sports. And I look back at that, and it was some of the best times of my life. And I just can't imagine what my college life would have been like without playing sport, and how much that has built me to the person that I am today, and has shaped my life here to be able to continue as a doctor, as a husband, as a father, and that experience is just wonderful. And that's what I think sports bring to people, and especially being on a team sport. Thank you, Dan. I appreciate the questions, and I hope all of you out there are staying safe.